Welcome everybody to this seminar on the humanitarian crisis in the Ukraine. My name is Stein Sundstøl Eriksen. I am a researcher here at NUPI and I will be leading this meeting, which is organized by NUPI in cooperation with the Norwegian Centre for Humanitarian Studies, which is a joint entity of cooperation between NUPI, the Peace Research Institute in Oslo, and Christian Michelsen Institute in Bergen. I should also inform you that the presentation here, the meeting, the whole discussion will be streamed and be on YouTube after the event. So the program for the seminar is as follows. First, we have 4 brief introductions. Then we have a discussion between the 4 panelists. And then towards the end, we take comments and questions from the audience. So we have 4 introductions. The first is from Marte Handor Myhre from Oslo Met, who will present some findings from a survey in the Ukraine on the contemporary situation there. The second speaker is Marte Bivon Erdal from PRIO, who will talk about the migration crisis and the challenges raised by that. Then there's Salla Turunen from CMI, who will talk about diplomacy and humanitarian, the attempts at diplomatic ways of addressing the humanitarian crisis. And then we have Karine Nordstrand from Doctors Without Borders, who will talk about the work of aid organizations and the challenges they face in Ukraine in the current crisis. Each of the introductions will last for about 5 to 10 minutes. So, with that, I ask Marte Handor Myhre from Oslo Met to give the first presentation.
Thank you so much for inviting me. And thanks to NUPI for organizing this very timely event. The situation in Ukraine is very worrying, and the brutal Russian invasion has shocked us deeply. President Zelensky yesterday described in a speech to the Norwegian Parliament some of the harm and damage that has already been done to his country. In my short presentation, I will focus on the situation in Ukraine. The Norwegian Institute for Urban and Regional Research has conducted research in Ukraine since 2008, and I was myself part of a research project that lasted until last year, where we cooperated extensively with Ukrainian partners at the VN Karasin National University in Kharkiv and an opinion poll institute called Operativna Sociologia in Dnipro. Our colleagues are deeply affected by this war, and currently one of our colleagues from Kharkiv is a guest researcher at NIBUR, and after fleeing from the hostilities in her hometown. So in the second week of the war, our colleagues from Operativna Sociologia contacted us at NIBUR and asked if we would be interested in doing a representative survey on the current situation in Ukraine. They conduct surveys based on telephone interviews and phone-based applications, and people are still using their phones in this situation of war. We were both eager to help our colleagues in Ukraine, for whom many of their usual assignments are put on hold, and interested certainly in data on people's situation in Ukraine currently, the level of displacement, people's financial situation, humanitarian needs, and also people's view on the future. So during this short presentation, I will present some of the results from this survey conducted by Operativna Sociologia between the 13th and the 22nd of March, with a sample of about 3,000 respondents. But let me first remind us that this humanitarian crisis that we are now witnessing did not start on February 24th this year, when Russia launched a full-fledged invasion of Ukraine. What we have seen in the last month or so is a great escalation and continuation of a military conflict that started back in 2014 with the uprising of Russia-backed separatists in the easternmost regions of Ukraine, Luhansk and Donetsk. The UNCHR estimates that between the 14th of April 2014 and the 31st of December 2021, more than 14,000 people had been killed, among them at least 3,400 civilians. And in 2015 already, Ukraine ranked 5th of the countries in the world housing the largest displaced population. The numbers of internally displaced in the period 2014 to 2021 given by Ukrainian authorities are around 1.5 million. And numbers here are uncertain because far from all that fled their homes to other parts of Ukraine have registered as IDPs. Many of those who fled from hostilities in Luhansk and Donetsk regions fled to neighboring regions or the capital Kiev or government-controlled areas of Donbass. Thus, they were living in areas that are now hit the hardest, and there are people being displaced yet again. Substantial numbers also fled the country back in 2014 and 2015. However, the current situation has caused displacement on a much larger scale. About 1/4 of the Ukrainian population is estimated to have fled their homes to other locations within Ukraine or out of the country. So according to our survey, almost 21% of the Ukrainians have left their homes. Our survey, as you can see, provides somewhat lower numbers than the UNHCR, and I believe this is related to the fact that children are not included and that operators were less likely to get in touch with people that had left the country concerning those numbers. Our data still shows clearly from what regions of the country displacement is occurring and who are more or less likely to be leaving their homes or remaining in the current situation. So our data clearly shows that it is from the hard-hit areas in the north, where the capital Kiev is situated, and the east most people are fleeing to other parts of Ukraine. We asked people about what language they use most in their daily life, and it turns out that respondents who speak Russian in everyday life were twice as often forced to move to another location within region within Ukraine, as people speaking Ukrainian in their daily life. Thus, there are many Russian speakers in the hardest hit areas, some sort of a tragic irony. It is also evident that the probability that people stay put increases with age and low income. Close to 90% of people over 60 replied that they have not changed their location, as you can see. As to income, it is quite evident that people's financial situation affects the decision to leave, in the sense that it is easier to make the decision if you have some money. There may be many reasons why people stay, of course. Many do not want to leave their home. Also, from some places, relocating has become nearly impossible due to damaged infrastructure, and in other places it's simply very dangerous. People's financial situation is very much affected by the war and is likely to deteriorate rapidly as the crisis deepens. We asked people to estimate how long their accumulated savings would last, and half of the respondents have either already at this point no savings, or they will run out very soon. So in 2-3 months, 70% of Ukrainians will not have any savings. As many as 38% report that they have been suspended from work due to the war, whereas 28.6% replied that they are working as usual. So people suspended from work due to the war may apply for a one-time payment of 6,500 hryvnia, that's close to 1,900 kroner from the authorities. And state employees are so far receiving their salaries, but the payment, at least for some groups, have been reduced. In terms of people's humanitarian needs, we provided people with a list for them to mark what they were lacking. And as you can see, a substantial percentage were lacking medicines, and after medicines came fresh food and also food that can be stored over time. Thus, the situation concerning food is already challenging for many, and more people will be dependent on humanitarian aid. Ukraine has been cut off from its ports, and there are challenges with deliveries and as well. 2 more slides. We try to measure people's concrete experiences with the war. As you can see, quite a few has family and friends whose home has been ruined, and quite a few have lost someone of their loved ones in this war already. We also try to measure how satisfied Ukrainians are with the help they get from international society. And as you can see from this slide, many found it difficult to answer whether or not aid is sufficient. I mean, this is indeed a difficult question to answer, but more than 40% signal that they are satisfied with the humanitarian aid and the financial assistance. However, when it comes to military aid, many more were capable to answer that question, and more than 50% partly disagree or disagree that the military aid is sufficient. To sum up, our survey confirms that the population of Ukraine is suffering a full humanitarian crisis. At the moment, Europe is being overwhelmed by refugees from Ukraine, but we must not forget that the situation of those still in Ukraine. We need to keep monitoring the situation, and we need to provide direct help. So for people interested in more of this survey data, there will be a breakfast seminar at OsloMet on Monday where we will elaborate on our findings. Thank you so much.
Thank you, Martha. Just one brief question. This survey, did that include the entire country?
Yes, all the government-controlled areas.
So the entire country except the Crimea and the eastern parts of the Donbas region?
Yes.
Okay. Well, thank you. Okay, then we move on to the next introduction by Marte Bivan Erdal, who will talk about the refugee crisis and this displacement problem.
Thank you. Should I sit down or just keep standing here? Or?
I think we now move the chairs out and we all sit up here.
Thank you very much for the invitation, Stein, and it's nice to be here. And thanks, Marte, for a really interesting presentation. So I'll try and keep my questions for you for afterwards, because I'd rather really ask you a lot of questions. And I'm very happy that you also stressed some of what I was planning to say to start with, namely that, of course, the humanitarian crisis is in Ukraine primarily. And there are different estimates of how many people have been moving. And as you pointed from your survey as well, there's variation. I've been reading up on work conducted by Frank Duvel and one of his colleagues called Irina Lapshina, who've been monitoring the situation closely and also been working on Ukraine for a very long period of time. And they keep trying to publish new scenarios of what might happen. And of course, we know that displacement is mainly affected by the violence of war, so the intensity of the violence. And of course, also the location in terms of where people are, whether they are able to actually escape. And we know that has not been the case in many places inside Ukraine now. So thank you for also just sort of pointing to the obvious, that the main humanitarian crisis, also as regards people who are displaced and on the move, is of course in Ukraine, and that is similar to all conflict contexts, which we of course know. So Frank Duvel and Irina Lapshina, in their sort of scenarios, suggest that actually not just maybe a quarter of the people of Ukraine may be displaced at this point, but it might be up to half in the worst case kind of scenarios of how things could escalate. And of course, we don't know what will happen in the next days or weeks, but this is kind of the scale we're speaking of, and hopefully this will not happen, of course. So mainly inside Ukraine, and also I think, as you alluded to, the main thing there is that we really don't know very well, because of course people are moving in and out of areas with extreme violence and conflict, and there is no registration or reporting, and people are on the move. And I think I'll start there in terms of understanding the dynamics of mobility in and out of conflict, that it is a case of mobility. When I was preparing for this, I was looking up the numbers of how many people have actually been going into Ukraine. and the Polish border guards are counting people relatively effectively both in and out. And since 24th of February, 364,000 Ukrainians have gone back into Ukraine. And these are both people who then have been living in Poland from before. There was about maybe 1.5 million or so Ukrainians living and working in Poland before the start of this invasion. But also actually a lot of cross-border mobility going back and forth. So I think the numbers for Monday this week was that across the Polish border checkpoints, 24,000 people came from Ukraine, whereas 12,000 people went the other way and back into Ukraine. So I think it's important to understand that our maybe sort of slightly static assumptions about what displacement means, fairly obviously, I think, are about real people making their decisions and trying to navigate. And so some of the people going back said, I want to take my children into safety. Now they're here, it's fine. Now I'll go back because I have an elderly parent who can't move, or I want to go back to my husband and I want to also contribute in the resistance. So the dynamics of the mobility are very sort of fluid and developing over time. Now, as you said, of course, people are coming into Europe. There's 4 million people who've left Ukraine in these past 5 weeks. And in one of the questions you posed, it was, where do they go? So, okay, if we then acknowledge that most of them stay within Ukraine, where do they go if they leave? And again, this is very similar to what we know from other conflict contexts. People go across the closest international border where they can to seek protection, and that could mean in legal terms and or, as I think we see in this case, just getting out of harm's way. So being in a country where they know that there will be no shelling, no bombing happening. And then the kind of legal and other aspects of that are in the sort of second phase somehow and not the most immediate concern necessarily. So we know that most people have come into EU countries and to Moldova. And then it's unclear how many people have been staying in these countries and how many people have moved on. Because, as I'm sure most of you know, Ukrainians who had biometric passports were able to travel on within the EU before this as well. So I think it's also a very, interesting situation where we have people who, up until 24th of February, were international students and labour migrants and temporary workers in many countries, and overnight, in a way, have become refugees. And for many of them, the legal papers they have are still maybe as students or labour migrants. And still we know that within the EU, they've decided to have temporary protection. That means slightly different things in different countries. I won't go into details on that, but there is this decision that there is temporary protection, where the two words kind of really suggest what is important. It's temporary. Because the situation is fluid, it's unclear. It is a temporary measure, but that we know from past experience has particular implications in terms of how you plan your life then as a refugee should worst case scenarios hit and this war actually last for a longer period of time. So that will then become a big question. What does this temporariness actually mean? And then what does protection mean? And there I think the right to work and what kind of entitlements you have also is things that are being worked out as we speak within the EU context, and also discussions that are being had also in Norway. And I think I'll say a little bit about the context in Poland to end in terms of where people are and what's happening, because this is the context I also am following the most closely, also being able to read and listen to Polish. So about 2 million people from Ukraine have come to Poland. Again, how many of them are actually there now? Estimates that I've been reading suggest maybe 1.34 million of the people who arrived. So that's on top of the maybe 1.5 million who was there before, perhaps. But this is also very fluid and unclear, and there are huge movements in and out. Germany, of course, as a neighbouring country to Poland, has about 250,000 Ukrainians who've arrived in the last month. Again, that's a country where there was also a significant group of Ukrainians working from before. So many of these Ukrainians who've arrived have arrived to family and networks in these countries to start with. The other bordering countries also have received quite significant numbers of Ukrainians. And again, we're not quite sure how many of them move on. But for instance, we know that the Czech Republic has about 250,000 Ukrainians as well. It's not a border area, but it's close to Slovakia, right? So sort of people have been moving on from there. So the situation is relatively fluid in terms of where people are and where they want to be. And there are signs that people actually do want to go back as soon as possible when they can for some. Whereas for others, the situation, of course, is different. And I think the temporal dimension here will decide what will be happening. Then finally on the situation sort of in terms of how they're met and what is happening. I mentioned the temporary protection that the EU has decided. I think a lot of the issues are at the detail level now. So with some examples from the Polish case, it's very clear that the legal rights to stay are there. It's very clear also that people are allowed to work once they're registered. But then there's a lot of bureaucracy in terms of, how do you get the right sort of social security number in order to be able to access different sort of benefits that are actually supposed to be there? How are you able to actually get a job, and how should your employer do the paperwork for everything to work fine? And just because of the volumes of numbers of people, this becomes quite a challenge to manage and practice. And also in terms of the schools and the health system, there's a lot of practical issues of, if a patient comes to the doctor and they need a medicine, then within these kinds of European welfare states, we have systems for how much the state pays and how much the patient pays, depending on which type of medicine it is. But how do you actually do that in practice when there is then 1.3 million people who have arrived and are ill at least at the same rate as everyone else is? So there are a lot of sort of practical details that are being worked out sort of as we speak, and where there are a lot of systemic challenges. And lastly, on the Polish reception, I think it's been very clearly communicated from both researchers and activists in Poland, not least from the Centre for Migration Research at the University of Warsaw, that most of what has been happening has been civil society, and that's even already maybe saying too much, because it's actually been grassroots movements, so not the big organizations doing really, really the brunt of the work in the border areas, and also for reception and information in train stations and accommodation that is being organized also a lot by sort of private initiatives and grassroots level. So really the kind of state response to this situation is only coming, and I think we are seeing the same in many other EU countries. So there's a lot of talk about crisis, which I'm a bit skeptical in terms of the term, and then actually what the states are doing, it's relatively slow and bureaucratic, although I'm of course happy that it's positive and there's a welcoming tone, but still I think it remains to be seen how this unfolds, if, as we fear but don't really want to engage, I guess, with this should last, which we don't know, it might, and then the challenges will still be ahead of us, I think, in many ways. So I'll stop there for now and we can pick up afterwards.
Thank you, Marta. I think we'll move straight on to Salah.
Thank you, Stein. And thanks so much for NUPI and NCHS for the invitation to be here, and good morning everybody who is in present and online as well following us. So I'll be discussing a little bit more today on the humanitarian diplomacy side of this conflict, as well as this kind of international relations perspective into the ongoing war. First, I'll begin with definition of humanitarian diplomacy. I understand that this isn't some sort of a term that everybody doesn't necessarily understand or grasp very quickly. So there are as many definitions for humanitarian diplomacy as there are actors involved in this arena. But the most commonly used definition derives from the Red Cross movement, which means persuading decision makers and actors and opinion leaders to act at all time in the interest of humanitarian needs. So why humanitarian diplomacy is important in this context? Humanitarian affairs can be often seen as the lowest common denominator at the international relations level and diplomacy. For example, one of the indications that we've seen this in this particular conflict is, for example, Putin's gesture of welcoming Ukrainian refugees into Russia on a conflict and a war that he has started himself. So that's the principle of humanity in action, which can be interpreted from that perspective, for example. And as my brilliant panelist colleagues have been here already highlighting, that the conflict zone is very much happening and active in Ukraine. So of course we know that the war and the conflict has horrendous effects there in the Ukrainian territory, but what is less discussed is also the Russian side. So of course in the media and the news we have heard quite lots about these Russian oligarchs and the sanctions and their behavior and their proximity to Putin as well. And then we've had a little bit conversations about the middle class, for example, in terms of consumerism, that there have been different kind of restaurants, from McDonald's to different shops to H&M and whatnot, who have stopped working in Russia. So we can see that there is some sort of direct impact also on the middle level. But what I am concerned here from a humanitarian sense is the worst off in Russian society and the poorest off. So meaning that there are beginning humanitarian needs emerging also within the Russian context. And it's not to say that these would have not existed already before this conflict, but this kind of economic sanctions and Cold War like measures hit the hardest to those who are worst off in the Russian society. So, for example, based on what I would say is an optimistic evaluation by the World Bank 2 years ago, Russia has been able to halve its poverty rates, so meaning people living under the poverty line, within the last 20 years. So back in 2002, number of Russians within the population living in poverty was around 25%, and in 2020, the population percentage went down to 12.1. But meaning that the war in Ukraine has a very quickly deteriorating trend also to the Russian population as is. Unfortunately, us as an international community most likely will hear very little about this. This is my estimation, given the shrinking or continued shrinking of the Russian civic space, as well as the limited media politics that are going on in the country right now. So I'm saying all this just in underlining the point that there is a humanitarian interest also in Russian side in engaging in humanitarian diplomacy at large, and international community, of course, as a whole in respecting international commitments such as international humanitarian law. However, I'd like to make the distinction between humanitarian diplomacy and humanitarianism as diplomacy. So this distinction has been first used by Jacinta O'Hagan, a former Irish diplomat and a current associate professor at the University of Queensland in Australia. So she has made the point that humanitarian diplomacy is the prerogative of humanitarian organizations and institutes. So this is their diplomatic engagement. This is their even political engagement in advancing humanitarian interests at the political and diplomatic levels. And humanitarianism as diplomacy is then the mechanism used by states. So in this case, Russia, in this case, Ukrainian. So it's usually often in their national interests. It's within line their foreign and security policies. And why I'm saying this is because of the breakfast seminar that we're having here today is titled Humanitarian Crisis in Ukraine, What Can Be Done? And here is a measure that I can see that can be done on an international organization side, an institute who are working in humanitarian affairs. Is that they play a role as international actors, creating this pressure and also engaging in these public and private forms of diplomacy within their own state leaders, for example, in creating these avenues of dialogue and using humanitarianism as a conflict resolution mechanism and a rhetoric tool as well in alleviating the suffering that is going on in Ukraine right now. I think I'll leave it here. Thank you so much.
Finally, last introduction, Karine Nordstrand from Doctors Without Borders.
Yes, Susan. Yes. Okay. So first, thanks a lot for the invitation, and thank you for being here, and also those following online, and not least thanks to super interesting introductions from these very knowledgeable women sitting beside me here. Yes, so I'm Karine Nordstrand. I'm a medical doctor and the president of the Norwegian section of Doctors Without Borders. I will call it MSF from now because that's kind of the acronym that we use. And just kind of a disclosure, I'm not an expert on Ukraine like some of you are, but I've been working, I also work at the Norwegian Institute of Public Health, where I've been leading a collaboration project with the Institute of Public Health in Kyiv in Ukraine for the last year. And also, you know, besides the operational updates getting from MSF, I've also been speaking to some of the people that we have on the ground in Ukraine currently. So just... Yeah, and I made my notes in Norwegian yesterday because I thought the seminar was in Norwegian, so I'll try to translate back into English. So the kind of starting point in Ukraine is it's a country with relatively good health indicators and a good health infrastructure, but still very big discrepancies in health. And there's a quite high burden of some infectious diseases like HIV, like TB, including MDR-TB, one of the highest rates of MDR-TB in Europe and in the world. And it has also among the lowest expected life expectancy in Europe, including a very high rate of Suicide, thank you. The humanitarian situation, you've been describing it quite well already. There's been a massive mobilization of solidarity in neighboring countries and also, of course, inside Ukraine. A lot of people, both private persons and grassroots organizations, not least, are in the border areas, and some places there's almost kind of a struggle to be the ones that are the helping ones. So a lot of people who are taking part in that response. I think few big international organizations are at this point in time able to kind of assist in a to a significant degree inside Ukraine. I think we should be honest about that, and particularly not in the areas where there are fighting ongoing. But it seems like everyone is trying to scale up and do the best that they can to gain access, and that includes MSF as well. So about MSF, we've been working in Ukraine since 1999, and then primarily that's been with projects related to treatment of HIV, tuberculosis, hepatitis, and also mental health projects. And during the pandemic, we also started new projects in Donetsk and Luhansk, and assisted in the national COVID response in the country. But then, of course, as a consequence of the war, we've been forced to kind of shift our activities from this focus on chronic infectious diseases to supporting the hospitals and so forth in dealing with war casualties. So we do what we can for the people who are affected by the war in Ukraine in the same way that we do what we can for people affected by conflict elsewhere in the world. We assist with humanitarian and medical emergency relief. And I think overall the humanitarian suffering that we're now seeing in Ukraine is very much the same that we have seen throughout the past 50 years of work in conflict areas elsewhere in the world, like we see now in the recent years in Syria, in Afghanistan, in Yemen, in Iraq. We have also, over the past few weeks, seen it's all recognizable, yeah. We've seen like a repetition of situations from earlier wars, like the wars in Balkan, like the wars in Chechnya or the Middle East. And I think this important to remember that this war is no different because of who it affects or where it takes place. The sufferings are the same, but what may be different is that it's the very extensive and profound global consequences of this war. And I think our conclusion in MSF is that everything that we thought we knew about geopolitical, about military or economic alliances, it now seems totally outdated. As a colleague of mine say, all bets are off, and that's alarming. From MSF, we don't, like anywhere else, we don't choose the side. Our side is the side of the patients. It's the side of the people in need within the country. And we are also very aware that, that there is still ongoing crises, humanitarian crises and conflict elsewhere in the world that brings about the same suffering that we see in Ukraine, and we shouldn't forget that, even if that's not in the media currently. So nobody knows what the next weeks and the months that come will bring, but as an organization, we will stay with the principles of neutrality, of independency, of impartiality, and these principles is what has made it possible for us to do our job for these past 50 years, and they are, it's a completely necessary tool for us to gain access, and they are just as relevant and important today. And we are also in Ukraine, like everywhere else, trying to talk to all parties of the conflict. We are sharing the positions of our medical activities with the warring parties and informing about where we work in order to remind them that the medical mission, healthcare workers, health facilities are under protection from international humanitarian law, and asking them to respect that. So in Ukraine, we see now currently how the war is putting enormous pressure on the healthcare system. They have, as you also mentioned, a problem with supply and also staff, even if a lot of Ukrainian healthcare personnel has stayed in the country in order to support the population. You've already said, all of you, I think, that it's important to remember that the majority of the refugees are still inside Ukraine, and some cities like Mariupol and Chernihiv, they are under almost complete siege at this moment. The situation there is very dire, and it's extremely difficult to get access there. In other cities, like in Odessa and Lviv, healthcare centers have been made into trauma centers instead. And we see that there is, like you were also mentioning, a big lack of medicines, the drugs, that the people there are suffering enormously under extreme pressure, and that the primary healthcare services are no longer functioning as they should. Today in MSF we have we have more than 100 staff working in Ukraine. It's both national staff and international staff, and we try to focus on sending in staff who are very experienced in working in wartime situations in order to support our teams on the ground. Our focus so far has been to support with surgical equipment to deal with trauma injuries, to supply for emergency rooms and intensive care units, and not least medicines. And there's really an intense race against time to get all this equipment, supply, and medicines into Ukraine until there may not any longer be possible because to reach these cities that are being besieged. So we're send in this equipment, and yeah, as you know, there are a lot of people fleeing to the borders, including using the train lines, and then these trains are going back and are almost empty because they were full of people, and then they are full of there is space there, so then we have used the train lines in order to put our supply on the trains and then get it into the country, because they are quite functioning still, and then also looking into the possibility of using these trains who are still running as for medical evacuation. There are, a lot of insecurity. Sometimes it's almost impossible to move around, and a big part of the, as I said, our support so far has been to help the healthcare system to deal with mass casualties and treat the wounded, and we do that either through mass casualty trainings in the hospitals, or to also giving telemedicine support, and also to a certain extent supporting directly on the ground in the hospitals. And we've been doing this, giving these mass casualty trainings in several big hospitals in Kyiv, in Odessa, in Lviv, Sitomir, and other cities close to the front line. And also then this big need of continuing treatment for those with chronic diseases. There's a high burden of chronic diseases in Ukraine, including diabetes, including tuberculosis, HIV, as I already mentioned, high blood pressure, epilepsy, etc. And these are all conditions that can become life-threatening if your medication is not continued. So we're doing what we can to supply that. And then there is, of course, we also see a big need of mental healthcare services. So that will be one of the possible focus areas in time to come. Yeah, we're also, as I said, present in the countries that are bordering with Ukraine, including in Poland, in Hungary, in Slovakia, in Moldova, in Russia and Belarus. And there we are trying to scale up our activities, but then focusing on the particularly vulnerable groups, including the non-Europeans, as were mentioned here before, who has not been as warmly received in many of these countries. And in Hungary, we have established these mobile clinics to give primary healthcare services, but also kind of mental health first aid to those to the refugees. We see, if we are to look forward, that many of the most vulnerable have, I think you have also mentioned that before, have not been able to escape their homes. Whether it is the elderly who are not able to move, whether it's people with disabilities, people who are institutionalized, including children. And now we also see that the healthcare services are reoriented towards treatment of the wounded. So that poses a real risk to these people being left without access to healthcare. Yeah, I think and without access to medicine. So it's a real need in the future to do whatever we can to support those. And then, of course, we're also worried about the war having enormous consequences globally with increasing prices, especially then on energy and food supply, and then 40%, I think, of the import of wheat from or export of wheat from Ukraine went to Africa and the Middle East before the war. It's so the situation now is gonna hit the poorest countries the worst. For instance, in countries like Yemen, in Syria, they are quite dependent on importing wheat and maize from Ukraine. I think it was low-income countries, 26 low-income countries had 50%, more than 50% of their import of wheat and maize came from Ukraine before the war. And then there's a funding problem in the World Food Program, and we see now also how funds are redirected towards Ukraine, even if there is really dire situation in terms of lack of food in South Sudan, in Afghanistan, in Yemen, etc. So that's a worry. And yeah, I think I spoke enough, but just to end, I just want to, since I'm also working in my day job at the Folkehelseinstituttet, supporting the kind of reception from the healthcare side of the refugees coming to Norway, what you said, I mean, some people are even calling this a refugee crisis in Norway, right? And we have had a bit more than 10,000 refugees arriving so far. And I recognize what you say, even in Norway, this problem of registering the refugees. And you can just imagine if that's a problem here, how it looks like in Poland with 2 million refugees. And so I think it's just really important to remember that this is not a refugee crisis for us. The crisis is for the people who are still stuck in Ukraine or still or not able to flee or not wanting to flee, but still suffering in Ukraine. And those who have fled, it's not a crisis for us, it's for them. So yeah, thank you.
Thank you, Karina, and thanks to all of you. A lot of big issues have been raised, and there's a lot of things we can discuss. I was thinking maybe we could try to split it up in 3 different issues. The first is the humanitarian crisis within Ukraine. What are the most fundamental challenges? Is it lack of funds? Is it lack of access? Is it lack of institutional capacity? And then the second could be the humanitarian consequences of the Ukraine crisis outside of the Ukraine, especially related to the refugee situation and how that can be handled. And then the third is what Karina mentioned here towards the end, the indirect humanitarian consequences for other parts of the world and other crises, especially linked to the food prices and energy prices, and what the implications of that would be for the humanitarian situation in other states. So maybe if we start with the internal problems in Ukraine, what would you, any of you really, see as the main obstacle or challenge facing humanitarian actors or even states in terms of dealing with the crisis there? I don't know who of you want to start.
So at the moment there are great regional differences, and it depends, of course, on how this war develop, how the situation will be on the ground. But as Karina just noted, so they're using trains to transport medicines. These trains are really crucial, both for people fleeing out of Ukraine, fleeing to other areas of Ukraine. I cannot just imagine if these railways are hit and these trains cannot no longer be running. It's also a risk that we might be facing. I would also stress that the grassroots initiatives and the civil society of Ukraine are really active at the moment in assisting in providing shelter, providing aid for people, for the regions where there is access, where there is possible to transportate aid. Aid is available to the people. I mean, put up in postal offices. I think it seems to be a quite well organized system of getting aid effectively out to the people. But then, of course, you have places like Mariupol that are really closed off from society, and this is very worrisome.
Maybe just briefly pick up on what you were saying with sort of some of the internal things and the mobility. And so I think the fact that there are trains running across and out, it's something we maybe don't necessarily always associate with conflict context, that this could be possible. So often we hear about roads being, bombed or blocked. But I think the role of the railways here is very central, but also I think of the roads and bridges. And so just this infrastructure, which is, of course, a huge vulnerability. And I think also in terms of the relative, not quite, but relative safety of parts of the country, which means that people are able to move to a relative safety, but still not be that far away. So like I was mentioning with this fluid mobility, that people have different options and different family members can be in different places, and they can kind of continue to choose their options based on the situation which is evolving. So I think if that relative safety of parts of the country disappears, that's, I think, a huge impact. But I think mainly it's this sort of very obvious question of time. So we're 5 weeks in now. How long will people manage to do what they're doing, which is, for so many people staying and mobilizing in so many different ways, and as Marta was saying, in terms of the civil society as well, sort of really being active and in all kinds of ways trying to support the internally displaced who are moving around. So I think my big question, in a way, maybe others can shed light on it, is, how long is it possible to sustain this, and how can international actors assist them in sustaining this kind of resilience also, when we're not speaking of 5 weeks, but maybe months.
Yeah, and I think that the problem, if you were talking about what is the biggest challenge here, like in any other conflict, is that the needs tend to be the biggest in the areas where there is intense fighting, and where it is the most difficult to gain access. So there is a enormous mobilization of grassroots movements and solidarity initiatives and organizations, NGOs, etc. But you see how it's kind of accumulating on the borders, because that's where it's the safest. And then some have been able to access into Ukraine, but then in the cities, like you were talking about Mariupol and so forth, it's really no one is able to access. But then, as you say, also the most important work is being done by the Ukrainian populations themselves, supporting each other within the communities, like it is in any other war-affected areas as well. And the local healthcare system trying to cope as best as they can, and they are doing the bulk of the work. But they are lacking, as we're saying, medicines, for instance, and can't do their work if they don't have that. So we need to focus on how to get that in, and then also try as much as we can to gain access to these areas that are hit by the conflict the hardest.
Perhaps also on with the categorization of what is happening now in terms of humanitarian needs and humanitarian affairs in Ukraine, and how it's reflected in the mobility and the refugee issues and whatnot. One cross-cutting theme is also, of course, gender. So what we see in humanitarian issues and conflicts elsewhere in the world as well, that any conflict is deeply gendered conflict, and any humanitarian affair and humanitarian need is also viewed through gender lenses. So if we think about combatant casualties, these are dominated by men, mainly because they are also the majority of soldiers are men. Not only, of course. Currently, for example, the Ukrainian army has around 22% of women in their ranks. But at the same time, then when we think about the civilian casualties, these are dominated in any conflict, including in this one, with women and children. So, of course, these are certain kind of lenses and understandings and nuances that we need to capture when we talk about these issues. And one thing that has been striking me and some others as well is that where is the women, peace and security agenda when we're talking about this? So we already have conflict-related sexual violence emerging and reported as well. And also then this kind of whole point of gendering soldiers. So for example, the Ukrainian men, we know that they are forbidden to leave the country if they're between the ages of 18 and 60, with certain kind of exceptions. Let's say that they're a single father of a child under 18, or they have more than 3 under 18-year-olds to support financially. So there are certain kind of clauses, but regardless, if you're a Ukrainian man within this age range, you are not able to leave the country. And this is creating many existing vulnerabilities. So for example, when we talk about transgendered people who might have a certain gender identity in their passport, they're not able to leave the country because of what is happening with this policy level, and not acknowledging their existence as they are. And of course, one thing that has been keeping me up at night is thinking about women as security providers in this context, and how problematic narratives we have sometimes when it comes to refugees and mobility, because the very act of fleeing is also a security measure. It is a risk mitigation measure, and taking you and your loved ones, would they be children, elderly, who not, removing them physically from the risk area into more peaceful areas and low-risk areas. So I think these are a certain kind of ideas that we also need to think about from a humanitarian sense and humanitarian aid delivery, that how can we target, let's say, women-specific conditions that need to be addressed, and male-specific conditions, and anything else in between these binary opposites.
Moving on to the question of the humanitarian situation for migrants and the way of addressing it. I'm thinking now, we mentioned the migrants within the Ukraine, but about those leaving. How are the support systems in neighboring countries dealing with it? Do they have enough funds? You talk about the grassroots movements, but that probably will not be enough to sustain it over time. So how do you see that going forward? And secondly, there was mentioned this specific problem that has been raised in the media about non-Ukrainian refugees from Ukraine who have been in an especially vulnerable situation. Could you explain or say something about how that is developing?
Can I start maybe, and then I'm sure you can pick up? So thanks also, Sala, for sort of pointing out that sort of who are these people actually, which is also something I wanted to come into, but you've covered a lot of that, so thanks for doing that. And I think I can start maybe with the second part in terms of people who did not have Ukrainian citizenship, say, when they were leaving. So we know that there were about slightly less than 300,000 foreign nationals living in Ukraine, but there were also people who were naturalized. And I think a lot of people who are experts on Ukraine, and you could add more, I think, on this, have pointed out that this is a country with a huge amount of diversity, 130 minorities, a lot of religious diversity, but also actually, there was something like 20,000 Afghan refugees, not recent, from the 80s, who were most of them naturalized and with kids maybe born even in Ukraine. So I think also in terms of the media focus has been a lot on some of the 80,000 international students who are also studying at the great universities in Ukraine before 24th of February. And rightly so, there was a lot of incidents that rightly got attention at the borders, but they were again also only a part of this broader picture of diversity and of people who've moved to Ukraine or who had backgrounds from other parts of the world and were minorities in different ways in Ukraine. So I think in terms of the reception of people coming out of Ukraine who were not seen as Ukrainians by those on the other side of the border, it's been mixed, right? And I think there was a lot of chaos at the border, especially in the first weeks. And so we know that there were reports of incidents where people were turned back or were asked to go back to the end of the queue. These incidents are, of course, completely illegitimate. Anyone who's trying to flee a war has the right to cross the border out of it. And I think, thankfully, the neighbouring states, including Poland and Hungary, also acknowledge that, which is not to say that there weren't incidents. There were, on both sides of the border. But I think the official positions on this, at least from these countries as well, which have a mixed track record on these issues, has in this case been right, and everyone has the right to leave. And then there have been quite open, I think, discussions about the fact that once you've left, it does depend which nationality you have. And indeed, countries like Ghana or India have brought their citizens back home, flying them out of Hungary or of Poland as well. And then you have the case of people who aren't able to or don't want to go to their country of origin, or their country of origin does not repatriate them. And then, in a way, they're stuck in a limbo. And indeed, that is the case with thousands of people. And I think the question of international students there is important. These are young people, talented people. They're not the poorest of the poor, but they're stuck in the middle of an international conflict that, they're victims of in a way. And the question is, how do we as a global community address that? The International Refugee Protection System is not put in place to help international students. They fall between the cracks there in a way. On the other hand, should they be given the chance to continue their education at a university, maybe then in Poland or somewhere else? Pragmatically, that would maybe make more sense than deporting them. But I think there are many issues that remain unresolved, and I'm curious as to where the kind of media limelight on these issues is now, because it seems to have gone silent. And I think, frankly, we don't really know what has happened with these hundreds of thousands of people as well. How many of them actually have left? How many are remaining in Ukraine? And what has happened to them? So we only have very scattered reports on these. So I'll maybe stop there, maybe others want to add, and then we can come back to the reception question as well.
Maybe just to piggyback on that thought, because I think thank you, Stein, for bringing this up. I think this is a very important notion to note. But at the same time, it follows the trends and the tendencies that we've seen in other conflicts as well, right? So we think about, for example, Palestinian refugees fleeing to Syria. There is this kind of double vulnerabilities that we are talking about. So in a sense that you are already a refugee or you're already displaced from your own region, and then within this context and the conflict context, it kind of doubles these existing vulnerabilities. Which is a very sad pattern, but we've seen it elsewhere as well. And I think this should be also discussed much more broadly in terms of other conflicts as well and other refugee ships.
I think also we can mention a point which scholars, I think in parts of Central and Eastern Europe, have brought up more, and maybe in Western Europe not, and then we can make of that what we will. But I think there is an interesting conversation where on the one hand we know that there are these double standards in how migrants and refugees are met at EU borders. And Ukrainians, because they did have visa-free travel with their biometric passports, are Europeans in that context, even though Ukraine is not an EU member. And so there is this double standard, and I think it's obvious, it's true, and it's not okay at all. It sort of speaks to the fact that the EU doesn't really live up to its protection goals in the way it should, by the way it's handling its own borders. And I think that we know that, and the politicians know that, everyone knows that, and the people drowning in the Mediterranean still today, sadly, are a testament to that fact. So there is this double standard at the borders, and there is a sort of, you can label it underlying racism, or you can prefer not to do that, but it's there, and the global inequality somehow is there. And so that's kind of been highlighted a lot, and I think that's important. And the other thing which has been highlighted less in the sort of West European context, but which I think is also interesting, is this sort of issue of migrants and refugees being used as sort of this hybrid war measure or instrument. And in this case, I think to the extent that we can maybe assume that this was a goal from the Russian side, it hasn't worked. And there are statements from the Russian side in November, October last year, which do suggest that they were hoping to create a quote-unquote refugee crisis. And we know that at the Poland-Belarus border, 8,000 people have been stuck, poor, vulnerable people, many of them who would have gotten refugee status had they managed to enter the EU. Some of them thankfully have, others are still stuck or have actually just given up and gone back to their countries of origin. And we know that this also, there wasn't sort of a moment where there were suspicions around this also around 2015-16 with the Finland and Norway borders with Russia. So again, this can be seen somehow as a sort of a way to distract the conversation from real issues of racism. So I'm not trying to do that. But I do think it also merits mentioning that this is part of this sort of political situation and actually of the war as such, and that people are stuck in many ways and being instrumentalized as sort of weapons of war, and that I think our role as researchers certainly is then to never forget that they actually first and foremost are people, and for the humanitarian actors, of course, then all people should be helped in a situation of crisis. But I think it is sort of quite complicated to disentangle these things.
As a follow-up on that, it's quite the massive support and sympathy for the refugees from Ukraine is, of course, encouraging in so many ways. But it does also raise the issue of how it contrasts with the situation for refugees from other conflicts and elsewhere. Could you reflect a little bit on what do you think accounts for this difference?
Go ahead.
Why there's such a massive mobilization now towards Ukraine, whereas we don't see the same in other situations, right?
Yemen or South Sudan or Afghanistan or Syria or...
Well, I guess that's quite obvious, right? That it's a country that is closer to us geographically, and it's I would assume that it's because it's also populated by people who, to a big extent, look quite similar to what we do, right? But then. And then, now everyone is, or not everyone, but people are saying that, we are assisting Ukraine more and we are mobilizing more because this is in the nærområdene. I don't know what you call that in English, but it's nearby regions that we have a bigger responsibility to support them. But then. You were mentioning this situation on the border between Belarus and Poland, where there were all these refugees stuck earlier in winter, and some of them froze to death, and no one wanted to help them because they were Syrian. They were not coming from Europe, but they were still in the very nærområde to us. But and all the people who are currently still stuck on the Greek islands, who have crossed the Mediterranean, they are also in the nærområde. But we're not at all mobilizing for them in the same way that we do now for Ukrainians. So it's not just about the proximity. It's more than that.
Yeah. Even one could also say that despite the crisis in Ukraine, the humanitarian situation is, after all, has been much worse in Afghanistan or in Syria, without leading to the same type of response.
Yeah, and we see now, for instance, as we were mentioning before, how South Sudan is having kind of the worst food insecurity situation the country has ever experienced, how there is starvation in Afghanistan, in Yemen, and how the World Food Programme is really struggling to reach, very much to reach their goals in terms of raising funds to support these areas, while money is now being poured into the response in Ukraine. It's not one thing or the other, but it's how there's really a shift towards focus on this situation right now.
And that brings to the last of the three issues that I mentioned here in the beginning of discussion, namely the indirect effects on the humanitarian situation elsewhere, because there was already building up starvation or hunger in Afghanistan or South Sudan. But now the war in Ukraine, which leads to increases in food prices and in energy prices, is likely to worsen that crisis elsewhere as well. So do you think that the Ukraine crisis will kind of distract from it, or could it also, perhaps more hopefully, lead to greater awareness and more willingness to compensate those whose already precarious condition is becoming even worse as a result of the Ukraine war?
Well, maybe I can continue on the previous thought as well, that there is, in humanitarian studies, we call it the CNN effect. So there's certain kind of media power that is displayed as well. So where's the media attention, there is the world's attention, there's fundraising attention, and there's donor interest in another way. So let's say that, for example, Afghanistan, Syria, and Yemen, and now Ukraine are these known conflicts. But when was the last time that we were discussing about humanitarian needs in Central African Republic, for example? So it's something that we have to pay attention to, of what we are not currently paying attention as a society, information societies. But what I was also thinking about these satellite effects that Stein is asking for, that of course we know the case of Africa, but also Ukraine and Russia have been major importers of wheat also to Middle East. So it's also politically very interesting going forward of what is the Middle Eastern reaction into the upcoming shortages of food.
I was thinking of two issues perhaps when I was thinking about what is there any kind of silver lining, so to speak, in terms of, like, let's say that hopefully there will be peace at some point, and what can we maybe learn from what has been happening somehow, And I was thinking sort of in terms of two areas, and one of them is in terms of protection and actually understanding the role of these neighbouring countries. Because I was thinking about it when when you were asking the response and how we respond. I think we need to unpack who is we. So are we thinking of the international community, the UN, the state system, all the humanitarian actors? Are we thinking the EU? Norway, notably, is also not a member of the EU, so do we include Norway in that? Or are we actually thinking specifically about the countries bordering Ukraine as part of, are they part of we then, or not really? I'm not sure they necessarily see us in Norway as part of their we right now. With the kind of numbers of people that have been received in Norway, the situation is kind of just so different in a way, in terms of how are we responding to it. So I think it's important to localize that a little bit, to sort of say, who are we? But I'm hoping that maybe that will, again, try to raise the support for all these countries across the Middle East, Asia, and Africa who are hosting all these displaced populations year in and year out, and for all these protracted situations where there is no resolution, and the Palestinian case being, the main one, I guess, in terms of length. But there's so many others. And that this, like you say, it slips off the radar, but the people are still there, and the situation for their future and their children's future is unresolved. So I'm sort of hoping that because it's sort of closer to home in Europe now, maybe we, as this bigger we, maybe can learn from this in terms of actually not forgetting and actually understanding what the impacts are when in the case of Poland, 2 million people entered in 3 weeks, to a country that doesn't have a directorate for integration. It doesn't have a system, an apparatus for handling this at all, like, for instance, Uganda does. So I think there's a lot of learning points there that are perhaps coming in surprising ways, and hopefully there will be a time when we can learn that. And the other area, which I know very little about, but where I'm thinking maybe, again, there might be implications, is in terms of energy, and sort of how we think about energy reliance and moving to more sustainable energy sources as well. And certainly shifts are happening in different ways than anyone anticipated in January. So that's sort of a space I'm also looking to. Once the war hopefully is over, that maybe that will be an area where things will change.
Well, on that last note, we kind of raises the long-term environmental, geopolitical and economic consequences that this might have, but that, I guess, would go far beyond the scope of the discussion today. But we are moving towards the end, but before we close, I thought we would open up for some questions or comments from any of the audience here. So does anybody have anything they want to ask the whole panel or individual panel members based on what's been said so far? Yeah, you there?
I'll take one there since I am, and I'll give it to you.
Okay.
Hi, my name is Maria Gabrielsen-Jumbert from PRIO and NCHS. I wanted to thanks all for really interesting and useful perspectives here. My question is for Karine Nordstrand on and sort of against the background of what Salah presented us about humanitarian diplomacy. To which extent do you now engage in any humanitarian diplomacy or negotiations for access in Ukraine, and to which extent is it just that in some areas you have access because it's possible to access, in other areas it's just impossible to access, as in Mariupol and other areas that are besieged? But I was wondering to which extent is the organizations such as MSF actually involved in trying to negotiate for their access, or to which extent is it just decided by the war, if you see what I mean?
Yeah, I mean, I'm certainly not the best person in MSF to answer this question, but I'll try as good as I can. Like in any other conflict, we are trying to have these conversations to gain access with all sides of the conflict, and that is also what we are doing in Ukraine, talking to the different military groups and the different governments in question here. But then when it comes to situations like that in Mariupol, we're not in any position to kind of gain access by ourselves. So then we need to kind of lean towards other actors such as the UN and so forth for those conversations. But we do try to talk to all sides of the conflict, and it's like was mentioned earlier. Also, the humanitarian assistance is kind of the lowest common multiple, and it's everyone understands that people in a conflict needs medical assistance. That's like whether it is for the people who are fighting, or even more so for the families of those who are fighting, for your children, for your wife who's going to give birth. So it's kind of it's easy to have that conversation and to gain understanding of that. We need to, if we are allowed into this area, we will support everyone, including your family and so forth. So that's kind of what the language that we're using and what is helping us. But it's very, very difficult at the moment. Yeah.
Hi, first of all, thank you everyone for good insights to this situation. I am Trude Jacobsen, Secretary General in Droppen i Havet. We've been working in Greece since 2015 and are still there, and also in refugee camps in Bosnia and Herzegovina, and now in Poland, in Krakow. Last time we saw a high influx of displaced people into Europe, especially in the second half of 2015. We saw this welcoming climate in all over Europe for the first 4, 5, 6 months, and then it changed quite suddenly. What do you think will happen when European countries start reaching the limit of support they can give and people they can help? Do you expect this same situation to happen with the, in a few months? When we see in Norway already we're starting to kind of panic for the high number of people coming here. But do you have any thoughts on that?
Like maybe say that I know this is a question which is also being asked in Poland, and especially in terms of the the volunteers that are there and the sort of smaller grassroots organizations, and I'm sure you know this also working there, that people maybe there was the school system in Poland is such that you have a sort of cascading winter breaks. So many people actually had winter breaks from work maybe in the first period, but people have to go back to work. The ones that have been volunteering their time, people who've had refugees in their homes. How long in a small flat with having people in your living room? How sustainable is that when everyone needs to go to school and work and people have flu or So I think there is this sense that the crisis mode reception was somehow mobilized, and that was not much thanks to the government, frankly, which didn't do anything to hinder it, but it didn't have an apparatus waiting. But how long can you keep up like that? So now there is a need for a system response, and I think in the neighboring countries they are trying to do that. And I think it's one of the things where I think it may be slightly different in the neighboring countries especially, is that the sense that the war is close, not geographically only, but in a kind of political sense, is very strong. So this is not just Ukrainians' war. And so if you remember the Ukrainian president speaking also here to the Stortinget yesterday, but in all of his speeches, sort of mobilizing these ideas about freedom and democracy, in the former communist countries of East Europe, that hits home in a whole different other way than it does here. I don't know how that will matter and how that will translate into, patience and willingness to kind of have longer queues at the doctor, more kids in the class, more tired teachers, all of these things that will inevitably happen if it lasts and people stay. But I think it puts a different light in a way on that maybe. But I do think that the only way it can work is if there is more relocation within Europe, if this lasts for months. And then it's a question of, with the numbers we're seeing in countries like Norway, which, as you also said, are so low, what kind of a contribution would that be? But I think ultimately it is, as you also say, about the time. So hopefully the war would end. Then there's a massive reconstruction, which was going to take years. So even then it would be long. But I think that is in a way what we have to hope for. And then, of course, the alternative is very possible. And I think there are very bleak scenarios and slightly less bleak scenarios. And I'm personally more optimistic that maybe the welcome will be as warm, but that people will manage. And I think Ukrainians themselves are doing so much to do that as well, like we saw that Syrians did in 2015-16, like we see that Afghans that managed to make it to Europe also do. So I think together it is possible. But I think the media point, the politics, that there aren't populist politicians who try to mobilize against this, that could tip the scale so easily. So I would prefer to be hopeful, but I share your concern.
Maybe to continue on that note, first of all, thank you so much for Tropihavet for the fantastic work that you do. I want to commend the organization to begin with. But also just to say that us as humanitarian scholars as well, some of us have been surprised by this enormous reaction to the Ukrainian context. So for example, we have this term called compassion fatigue, which you would know very much about as well. So we think about the Palestinian context, over 70 years of conflict, Afghanistan since 80s, depending how you count, same with Syria, 11 years. So in a sense, what Karine was pointing out already, that these are difficult areas in order to mobilize, difficult areas to fundraise for meeting these enormous humanitarian needs in these contexts. So all of a sudden, why this, and same with Stein's question as well. So this has been very much catching us by surprise, that what is the current momentum and the interest of the international community. But I also would want to maybe ask Marte, since Marte knows the Russian context, and there have been also Ukrainian refugees fleeing to Russia, that what kind of a dynamic is going on and unfolding there, if there's anything that you can comment on that.
So
Well, I was looking into a lot of Ukrainians fled to Russia after 2014. The situation was different. Russia was not in the same way as now perceived as the aggressor, although they were supporting the separatists in the eastern Ukraine. And for being Russia, Ukrainians were warmly welcomed. Compared to, I mean, Russia is not known as a safe haven for refugees at all, but they actually mobilized greatly in 2014-15 in order to receive these immigrants. But they also had a quite pragmatic outlook on this in relocating people to areas that are not densely populated, sort of in order to, quite pragmatically actually relating to this refugees. And there are rumors now as well that, you know, people have been relocated to Russia not contradictory to their own will, right? And that they are being sent to remote regions and their passports are being confiscated. I cannot confirm this is going on, but so knowing the situation in 2014-15, Russia has had then a quite pragmatic take on the refugees, although for being Russia, they were welcome, they were provided with housing, etc., etc., etc. And the population in Russia, as we've been talking about in Europe, so with time, sort of they were less welcoming, and there were rumors that the Ukrainian refugees were getting financial support from the state, and this created a lot of discontent among the local Russian population that has been pointed at already is not all of it in a great economic financial situation. So yeah.
I think that's one of the questions we really don't know answers to, and I've also spoken to others who know the Russian context, and the UN numbers are that there's some 300,000 or more, we don't know, people who've actually gone to Russia, and of course that is the longest border on the eastern side, so it makes sense if you want to get out of the shelling, but on the other hand, that's also the invading country. So what do we make of it, and do people go there because it's out of harm's way, because they support Russia, is it because they have family there? Are they, are some people actually forced to go there? We don't actually know very much about what is going on, and it's a really significant number of people who have been displaced into Russia. So I think this is also a space that we, probably should be watching closely going forward.
Absolutely, and from my data from 2014-16, people were talking to Ukrainians who had fled to Russia. Some of them had actually first fled to safe areas in Ukraine, but they had troubles finding work, and then there was a possibility to go to Russia. I mean, now the situation is very different, so you will not go to Russia and then go back to Ukraine, and so we can imagine that people going to Russia are either forced to, because it's not possible to go in the other direction, or Russia is forcibly sort of relocating them to Russia. Very hard to imagine any Ukrainian voluntarily going to Russia at this point.
One more question there.
This is Trude Falk from Norwegian People's Aid. We are not still in Ukraine. We are going there next week for an assessment mission, and then we've spent the last week kind of trying to understand the patterns around Ukraine. And several of you have been talking about this grassroots mobilization inside Ukraine, outside Ukraine. And there are several aspects of this which are actually, it's a big discussion actually, but that's what we see also when we are talking with different actors. NPA is always working with local organizations. We are never direct implementing, also not in crisis. So for us it's interesting to understand how people are mobilizing on the ground, who are the actors, who are the organizations, how does this actually spell out? And what we see is somehow that this is a massive network of volunteers. It's linking up the Euromaidan, the civil society, engaged individuals inside and outside of Ukraine. They're mobilizing a lot of resources, and they actually also have access to a lot of the most people in need. While the international organizations, most of them, as has been said already, are remaining at the fringes of the conflict. Because we are remaining in safe areas and outside Ukraine, where you also see that those less in need, even if they are refugees, are outside of Ukraine. Those most in need are inside Ukraine. So my question is, doesn't this raise some dilemmas? Because we've kind of had now this rationale since the 90s, at least, of this very kind of depoliticized humanitarian assistance into crisis conflicts. While I see this Ukrainian conflict is actually a mobilization which I recognize being relatively old, from the old solidarity movements. This is an enormous solidarity mobilization for people in need against an aggressor, intruding into a country, creating a massive humanitarian crisis. It's not kind of de-linked from politics. And doesn't that raise some questions in regard to humanitarianism as such, and who you actually engage with in such a crisis to get access to those in need?
I can comment briefly on that, because I think, I totally see your point, and I think it's a really valid reflection. And it's not just about the grassroots mobilizations and how this humanitarian assistance is kind of politicized in this situation. It's also about the donor side right now. For instance, how a lot of corporations have taken a stance in the conflict and really, they. Towards the Ukrainian side and being quite political in how they express themselves, and then giving big donations to organizations who are to humanitarian organizations and other who are part of the response on the ground, which is also feeding into this politicization of humanitarian aid on the ground. And it's been, we had quite heated discussions in MSF as well on, what to accept in terms of funding in this situation. And it's also this pressure on how to respond and to what extent to respond coming from donors in this situation, because people want to see action from humanitarian organizations in Ukraine. And for MSF, we have not been taken, or we have not actively been asking for earmarked funds in this situation, because, as you also said, it's really difficult to gain access inside Ukraine. And then we don't want to actively ask for money to support our operations there when we don't know to what extent we will be able to use that money in a meaningful way in the country. But this money, that's kind of, it's a lot of donors are eager to give money to humanitarian organizations so that they can assist in Ukraine. That's also kind of orienting that assistance into. It's not really respecting perhaps the principles of impartiality, where you actually are, where your actions are directed by where the needs are the most, but this is where kind of the political pressure to act is the most, so to speak.
I can add also, I think there's, I'm no expert on civil society in Ukraine, but it sort of strikes me that there is a resemblance here in terms of what we see sometimes elsewhere as well. When crisis hits, all the big international actors sort of move in and become very visible. And there is this sort of tension in terms of how you then collaborate with partners, and I know many organizations do that well, and in terms of the health infrastructure systems and working with them and not trying to replace them. But there is this sort of dilemma there in terms of what happens then when you remove yourself from that situation, what was there before and what stays. And so I was mentioning, for instance, religious institutions. We know that there are organizations like Caritas who is working there and who was there before. They are there now and they will remain later. And there are many other examples of organizations who are there, but maybe not chapters of the biggest international humanitarian organizations, because it wasn't a country that had many of those present before. So I think it sort of poses some questions about humanitarian work as well. But I think, the work that your organization is doing, I think the same principles apply. But like you said, it is a question then of how do you find the partners, and how can you be, pretending that it's neutral, because it can't be, right? So it sort of poses questions to some of those ways of working, which again, I think maybe we can learn something from that, because there are other conflicts as well that are also very hard to be neutral within. But I think thankfully there are actors on the ground that can be collaborated with and who are there, and there are actors in Norway as well who have been working with teachers, for instance, slightly different, but there are these networks and contacts with people in Ukraine also that can be accessed to at least reach the areas where it's relatively safer. It still goes without saying that where there is outright war and violence, it's incredibly hard anyway for anyone.
I think in many locations in Ukraine, as you noted, so the big organizations are not visible at present. So it's really the local grassroots organizations mobilizing in order to help the internally displaced, but also in cooperation with local authorities. So to give a concrete examples, I was talking about these issues with our colleagues in Dnipro, and they explained that they had been paid by local authorities to keep like this phone service open for information phone service for internally displaced, and they could then direct people to various voluntary organizations that provide different services. And local authorities would also help in the sense that they could provide some property, so where these local organizations could provide the services for people.
Well, thank you. It's clear there are no easy solutions, not to the crisis in Ukraine, not to the eternal dilemmas of humanitarianism and politics, but the issues need to be continually discussed and reflected upon, and I think this seminar has been a good example of that. And I would like, to close, to thank the 4 ladies on the panel for good introductions and good thoughtful remarks in the discussion. And also thank you to those who have been here and those who may be watching it on YouTube. So, thank you on behalf of the NHS.
Il est intéressant de